So if you could please make sure that you're muted and we will go ahead and get started. So I will pass it off to Michelle.
Yeah, good afternoon, everyone. Thank you for joining us. This will be for 2024, our last town hall on the community support waiver. And then we will start again next year in 2025. So we will be covering a number of topics during this meeting. The hosts will be Lisa Worm and Jackie Merriweather, Audrey Davis, and Javante Marshall, and Sheena Hoyer Ward and Kristen Gore for the different topics we will be covering today. So I will turn it over to Lisa.
Thank you so much, Michelle. Thank you for joining us today with KDADS and helping us answer questions and moderate the meeting. So we've already gotten started, but we'll go over today PCG's role, which is who will be doing the presenting today. We'll have a short poll question. We'll provide some brief updates. We'll go over provider qualifications and other numerous services that were provided on the CSW. And then after the conclusion of that, we'll have questions, and then we'll go into the rate study presentation as well. So that's what we'll cover today. And I am going to hand it off to my colleague, Audrey, to talk a little bit more about why we're here today.
Thank you, Lisa. Hi, everyone. My name is Audrey, and I'm a member of the stakeholder engagement team. And I'm going to just review the goals of the CSW as well as Public Consulting Group's role on this project. The Community Support Waiver, or CSW, is a new Medicaid waiver that PCG and KDADS are developing alongside feedback that you, the stakeholders, will provide. This waiver will assist Kansans with intellectual and developmental disabilities, or IDD, who do not need continuous 24-hour support. The CSW is aimed to promote community inclusion and therefore will expand and support community care choices as well as natural support systems to make it easier for anyone to live independently at home and in their community. Next slide. So moving on to PCG's role, Public Consulting Group, or PCG, is a public sector consulting firm that works with state health, education, and human services agencies. We are partnered with the Kansas Department for Aging and Disability Services in order to assist with the developing of the community support waiver, which includes writing and organizing the CSW, designing a plan for implementing the CSW, as well as collecting feedback from stakeholders like you, whether in forums like these town halls, in our technical advisory group, or through feedback submitted through our email or our website. So now we are going to launch a poll. If we can move on. Yeah, perfect. Now we are going to launch a poll. Hold on just one second. Just making sure we have this poll. Hey, Lisa, do you have the poll that we can pull up?
Yes, so sorry about that.
No worries. So we're going to leave this poll open for about a minute, and I'll read aloud what the poll asks, which is what best describes who you are representing today in the different stakeholder engagement groups.
No biggie.
We'll leave the poll up for probably about 30 more seconds. And if you miss this poll, no worries. It's just an informal poll to see who is with us here today. So we appreciate your participation. And engagement. All right. So we're going to close the poll right now. Thank you all so much for completing this. It's really nice to be able to see what different stakeholder engagement groups are represented here and see how many folks were able to join us. You should be able to see the poll results right now. So thank you all for participating, and Lisa, I'll pass it back over to you.
Great. Thank you so much, Audrey. Thank you to everyone who's here today. So we just want to provide some updates since we last met last month for the town hall. So the kansascsw.com website has been updated with a new service definitions page. So that page includes the currently proposed draft CSW services and their definitions, which you can provide feedback on, as well as the third town hall from last month, meeting materials, which includes a recording, the slide deck like we're sharing today, and a transcript. So the other major update is that KDADS will add home telehealth as a service offered on the CSW. And what that means is that it will be limited to participants who've had 2 or more hospitalizations or ER visits within the previous year, or for participants who are transitioning out of a nursing facility. So it's currently offered on the frail and elderly waiver, but we want to extend this on the CSW as well. So you can read here what the home telehealth service does include. So it will be limited to the use of telemonitoring technology. So that could include something like a mattress to remotely monitor vital signs. So providers will be able to provide education for patients specific to their disease management. And monthly status reports will be sent by the providers to the participant's physician and MCO care coordinator. So that's the most recent update on home telehealth on the CSW. And now I'm going to pass it to Jackie, who will go over provider qualifications.
Thank you, Lisa. Yeah, so as Lisa mentioned, I'm going to just talk about the qualifications that CSW providers have to have. So first off, they must complete a background check in accordance with the KDAD's background check policy. So the background check has to include a criminal record check through KDAD's health occupation credentialing, and abuse, neglect, and exploitation, otherwise known as an A&E check, through the nurse aid registry. And then if a provider is transporting participants as a part of the service, then they also have to go through a driver's license record check through the Kansas Department of Revenue. Additionally, there has to be an adult and child A&E check through the Kansas Department of Children and Families, and then an excluded entities and individuals check through the Office of the Inspector General, or OIG, and then also a check through the National Sex Offender Registry. Next slide. So there are some background check exceptions for individuals who self-direct their service. So if you're a participant of the CSW, you're self-directing your services, you can choose who you want to hire to be your provider. And you have some flexibility to hire an individual with convictions, so long as the individual is not listed on the OIG exclusion list. And if you're a participant on the CSW who does want to hire somebody with a conviction, the participant has to review those specific offenses that come up on the potential provider's background check, and then consider how relevant is the offense to the job that the participant wants to hire the provider for? How much time has lapsed since the offense occurred? If there's any sort of evidence of rehabilitation or, the potential for reoffense. And then the self-directing participant has to document their rationale for hiring the individual despite having a conviction, and then sign an attestation stating that they are aware of the risk and they hold the state or associated agencies harmless from any sort of liability, claims, or damages that may arise from the participant's decision to hire the individual. Next slide. So some other general requirements for all providers is that they either have to contract with a financial management service provider, which we often call an FMS, or through a CanCare MCO. So for providers that are hired by a participant who's self-directing their services, they will then enter an agreement with the FMS. The FMS is who's responsible for verifying that the provider being hired meets all of the qualifications for the service, and then the FMS will also coordinate that background check. For providers who are not hired through self-direction, so agency-directed services, the provider has to contract with a CanCare MCO and then also affiliate with the Community Developmental Disability Organization, known as a CDDO, for the areas in which they operate. Next slide. Again, another general requirement of all CSW providers is that they have to comply with the HCBS settings final rule. So the HCBS settings final rule established some minimum standards for ensuring that participants are integrated in and have access to the community and have choice and autonomy. So this was a rule established by CMS, which is part of the federal government. They're really looking to ensure that the setting in which these CSW services are delivered really reflect the individual's needs and preferences, and that individuals have, and that providers are offering choice. Options for settings have to include non-disability specific settings, such as competitive employment, or an integrated public setting, volunteering in the community, or engaging in general non-disabled community activities. And we've linked here just CMS's HCBS settings toolkit if you want to try to learn more about all of the things required under the settings final rule. Next slide. Okay, so there are some rules regarding relatives and legal guardians when they can or can't provide services on the CSW. A participant's relative, legal guardian, or person legally responsible for the participant may be paid to provide certain CSW services. Foster care parents are an exception. They cannot be paid for providing any CSW services. Participants will be educated by their managed care organization that they're not required to use their relative or legal guardian as a paid provider of waiver services, and the individual will be offered a choice. The person-centered service plan has to document when services will be provided by a relative or legal guardian, and has to document that that choice is in the best interest of the participant. And then any sort of CSW services furnished by a relative or legal guardian are really limited in scope, duration, and amount as determined by the MCO's needs assessment and authorized in the person-centered service plan. So if an individual participant's legal guardian is being hired to provide personal care services, for example. They can't provide an unlimited amount of personal care services. It really has to follow what's documented in that participant's person-centered service plan. And then any sort of direct service workers, which includes parents and spouses, have to utilize the electronic visit verification system, otherwise known as EVV, to document their time paid. Next slide. All right, so I'm going to go over the individual provider qualifications for all of the different services on the CSW. I'm going to start with a category of services in which participants have employer authority. So next slide. Personal care services is one of the services on the CSW where participants have employer authority, meaning if they self-direct their services, they can hire an individual to do this for them. Personal care services can also be provided by a home health agency. Home health agencies have to be licensed in accordance with KSA 65-5101. And then the related KAR, which is the administrative rule. Staff providing personal care services must be at least 18 years old or older and have a high school diploma or GED. Any sort of health maintenance activities that occur within the realm of personal care services. So that could be like monitoring vital signs, any sort of medication administration, providing like ostomy or catheter care or wound care. Those are all considered health maintenance activities, and those have to be performed or delegated and supervised by a nurse or physician. Next slide. So like I mentioned, personal care services allows participants who are self-directing their services to hire an individual personal assistant. This individual personal assistant could be a relative of the participant, a legal guardian, or a person legally responsible for the participant. The provider has to be at least 16 years old. If the participant is going to hire one of their siblings to provide personal care services, the sibling has to be 18 years old, unless an exception has been granted in writing by the LTSS Commission. And then a participant is really responsible for documenting that the provider that they hire through self-direction has received sufficient training to provide the service. Next slide. Okay, so respite. Respite can be provided by a community service provider or a CSP is often what they're called. Community service providers are licensed by KDADS. Respite can also be provided by a community mental health center, otherwise known as a CMHC. And then individuals who are self-directing their services can also hire an individual respite provider. So for those respite providers that are hired by a participant, they can be a relative, but they can't be a legal guardian or a person legally responsible for the participant. They have to be age 18 or older. They have to reside outside of the participant's home, complete KDAD's mandated training. And in the case of self-direction, the participant hiring someone to provide respite services, the individual can add on any additional qualifications that they want out of their provider. Next slide. Family caregiver support and training is another service on the CSW, can be provided by a community mental health center, a licensed mental health professional, or a center for independent living. For all of these, you'll see that the provider has to be 21 years or older, have a high school diploma or equivalent, and then complete a parent support training or another approved training curriculum. Next slide. Family caregiver support and training can also be provided by a community service provider, which are licensed by KDADS. They have that same sort of age requirement, diploma requirement, and training requirement. And then same with a family caregiver support peer provider. So an individual self-directing their services could hire a peer to provide this sort of support and training. This peer would have to have a high school diploma, be 21 years or older, and complete that parent support training. And then they also, to be considered a peer provider, have to have 3 years of direct care experience or be the parent of a person with an intellectual or developmental disability. Next slide. Non-medical transportation. So this can be provided through public transportation or through a contracted transportation agency. So for contracted transportation agencies, they have to comply with the same requirements that are established for non-emergency medical transportation, which include some driver requirements and some vehicle requirements. So the driver requirements, the driver has to be age 21 or older, possess a valid driver's license with no restrictions other than corrective lenses. They can't have any limitations that would interfere with safe driving, such as if they had like a medical condition or something that could interfere with them safely driving. They have to pass a pre-employment drug screening, and then they have to agree to not smoke while transporting participants, and they can't be under the influence of any drug that impairs their ability to drive safely. Next slide. So the vehicle requirements that are established for these contracted transportation agencies are that all of the vehicles have to be licensed and registered as required by Kansas law. They have to maintain no less than the minimum automotive liability and medical insurance coverage as required by law. The vehicles have to be kept in proper physical and mechanical condition and also equipped with seat belts, turn signals, lights, ventilation, etc. And then the vehicles also have to pass a safety inspection. So the last sort of provider type for non-medical transportation is an individual driver. So this could be someone that is hired by a participant directing their services. The participant could hire their relative, but they can't hire their legal guardian or person legally responsible for them. The driver that they do hire has to be 18 years or older and have a valid driver's license. And then their vehicle has to have proof of insurance, inspection, if applicable, and registration. All right, so now I'm going to go over the provider qualifications for counseling and therapy services offered on the CSW. So family adjustment counseling can be provided by a community mental health center or a licensed mental health professional. Occupational therapy can be provided by a licensed occupational therapist. Kansas law also allows for unlicensed assistants to provide occupational therapy services so long as they're supervised by a licensed provider. Next slide. Speech and language therapy can be provided by a licensed speech language pathologist. And then physical therapy can be provided by a licensed physical therapist. And they have the same statute that allows for unlicensed assistants to provide the services so long as they're supervised by a licensed provider. Next slide. Behavior therapy can be provided by a licensed social worker, a licensed psychologist, a certified behavior analyst, and you'll see in the bullet below what a certified behavior analyst could include, the different sort of levels of doctoral versus assistant behavior analyst, etc. And then also a registered behavior technician can provide behavior therapy. There's also another type of provider that is generally called just an other behavior therapy provider. So if you don't fall into one of those other provider categories, you could still provide behavior therapy if you have a letter signed by KDADS validating that you meet these alternative requirements. The alternative requirements include having a master's degree, documented experience working with a person with IDD, and then you've also completed a state-approved training curriculum. Or you could also be an individual who's age 18 or older and have a high school diploma or equivalent, but have completed 40 hours of applied behavioral analysis training, and you've demonstrated through an initial competency assessment that you're competent to provide the service. So next I'll go over the provider qualifications for our vendor services. Next slide. So vendor service providers, there's kind of three main types. The following vendor services kind of all have these three main types, so I'll sort of lump them together. Assistive technology, specialized medical equipment and supplies, home and environmental modification services, and vehicle modification services. Those are our vendor services that have these three main provider types. First is Centers for Independent Living. Second is individual direct contractors. And the third provider type is a non-CanCare enrolled indirect contractor. You'll see that a few of these services have an asterisk next to them, which means that they have some additional provider types that we will also explain. But I'm first going to start with the qualifications for the three main types. So Centers for Independent Living have to have a certificate of workers' compensation and general liability insurance to provide any of those vendor services. An individual direct contractor has to be contracted with an MCO, be appropriately licensed, and conform to the industry standards and laws that govern the service. They also have to have proof of business establishment for a minimum of 2 consecutive years, and then have the same sort of certificate of workers' compensation and general liability insurance. Next slide. And then that last sort of third provider type is the non-CanCare enrolled indirect contractor. They have the same exact qualifications as the direct contractor. The only difference is that an indirect contractor can be subcontracted by a Center for Independent Living to provide the service, and they don't have to be contracted with an MCO. Next slide. Okay, so if you remember those couple of asterisks on some of the services that have additional provider types, home and environmental modification services and vehicle modification services have one of those asterisks. These two services allow for relatives of the participant to provide the service, so long as the relative meets those provider qualifications as a direct or indirect contractor. And then assistive technology is another one of those services that had an asterisk. So assistive technology consultations, the consultation to determine what types of assistive technology could benefit a participant, those can be provided by a licensed occupational therapist, a licensed physical therapist, a licensed speech language pathologist, or another assistive technology professional. And assistive technology professional is defined as someone who has a certificate from a nationally recognized assistive technology assessment curriculum, or somebody who is considered a technology expert. They have a bachelor's degree and have been employed by an assistive technology provider for at least a year. Next slide. All right, so I'm going to go over the provider qualifications for the ongoing monitoring services that are offered on the CSW. First is medication reminder services. This can be provided by a medication reminder services provider agency. So this provider agency type has to abide by the industry standards and also provide appropriate training to their staff on medication administration and dispensing of medication. Personal emergency response system and installation is another one of our sort of ongoing monitoring services. The PERS providers have to conform with industry standards and any sort of laws and regulations that govern the service. And they have to have an emergency response center that has to be staffed 24/7 by trained personnel. Remote support services have those same sort of requirements. The provider agency has to conform to industry standards, and they also have to have a remote support service center that is staffed 24/7 by trained personnel. And then home telehealth. So if you remember earlier in the presentation, Lisa went over how home telehealth is a new service that CSW, that KDADS is adding to the CSW. And a reminder, it's sort of that remote monitoring of a participant's vital signs to help them better manage a disease that they might have. So home telehealth can be provided by home health agencies or by county health departments. Home health agencies have to be licensed in accordance with the statute. And then providers, whether it's a home health agency or a county health department, have to monitor or have to have system equipment capable of monitoring participant vital signs, including at minimum heart rate, blood pressure, mean arterial pressure, weight, oxygen saturation, and temperature. They also have to have a system that's capable of asking the participant questions that are tailored to the participant's diagnosis. And this system also has to be able to communicate in the participant's chosen language. All right, I think this is the last section of provider qualifications. We're going to go over the qualifications required of employment service providers. So first is benefits planning. Benefits planning can be provided by a certified benefits planner, which means that they have to maintain a current national certification accepted by the Social Security Administration for its work incentives planning and assistance program. It's often called WIPA. Or if they have another certification that is approved by the HCBS program. There are a couple examples below about the different names that could be accepted, or sorry, certificates that could be accepted. A certified community work incentive coordinator, a community partner work incentives counselor, or a credentialed work incentive practitioner. Career exploration and planning is another one of the employment sort of services that will be offered on the CSW. And providers of this service have to be licensed by KDADS as a community service provider or CSP. And then providers offering this service also have to maintain an industry certification in employment supports, such as an APSE or an ACRE employment professional certification. Individual employment support services have those exact same requirements as career exploration and planning. So they have to be a licensed CSP and have that industry certification in employment supports. Life skills services can be provided by 3 different types of providers. A certified life skill provider, which would just be a licensed CSP. They don't have the same sort of employment supports certification that are required for the other employment services. Because life skill services is slightly different. And then a center for independent living could also provide these life skill services. Stills have to have a certificate of workers' compensation and general liability insurance. And then life skills peer providers can offer this service. The peer provider has to be 21 years or older, have a diagnosed disability, have a high school diploma or equivalent, and have to complete KDAD's mandated training. Okay, so this is where I'll pause. I went through all of the provider qualifications for all of the services on the CSW. I know it was a lot of information, so I'm going to ask Peter to help us take any questions from the Q&A.
Thank you, Jackie. I appreciate you running through all of that for us. So, as we said at the beginning, there is no chat functionality during this webinar just because there are so many of us and it would be difficult to moderate and run through. So if you do have any questions, you can do one of 2 things. You can post your question in the Q&A, and we'll be happy to run through those and answer as many as we get. I see we already have some in there now. Or if you'd prefer, you can also raise your hand, at which point one of the PCG moderators will give you a chance to unmute and you can ask your question in person. So those are sort of our 2 options. So I'll start. We have a couple open questions in the Q&A. We'll start there and we'll just sort of move forward as we get questions. So the first one from Craig Knutson. Jackie, you're probably the best position to answer this one. Are all these different therapies subject to the $20,000 annual cap on the CSW? I imagine everything is subject to the $20,000 cap. Is that right, Jackie?
Yeah, I will say that sometimes like occupational therapy or physical therapy, a participant might be able to get some of those services covered through their like CanCare state plan sort of services. So I know this will be a topic for a future town hall, but if anytime you can get like physical therapy or another one of these services through another program, then the participant will get it through that other program so that it doesn't count against their $20,000 budget cap. But yeah, that $20,000 budget cap is inclusive of all of the services that you would receive on the CSW.
Thank you, Jackie. I'll keep you on the hook for a couple more. I think these are appropriate for you. Lee McNeil asks if the life skills providers include day service providers.
So I think there could potentially be some like overlap, like if they are a certified a CSP, a certified or why am I forgetting the term now? If they're like a licensed CSP and they're providing day supports currently, there is the potential for them to also provide life skill services. So yeah, I hope that answers it.
I think so, Jackie. And if not, please just whoever, Lee, if you have more questions or anyone else, obviously just jump in whenever. So let's go to a few people raising their hands. First, we'll just go in order. So Cassandra Signs, if you'd like to ask your question, you should be allowed to unmute now.
Has there been discussion about whether somebody who currently can live at home with their family, and then something happens to their family and they no longer can live independently with their family and needs more residential, what happens to them at that point?
So Michelle, I'll give you a chance to expand on this, but I think this might fall into our general category of we're not exactly sure how individuals might transition between waivers at this stage. Like, let's say they need services that the CSW can no longer support, things along those lines. So we're still working that out, Cassandra, but obviously, as we said, we'll give you more information on that as we have it. Michelle, anything to add to that?
No, Peter, we are working on a transition plan on how people would move between the comprehensive waiver and the community support waiver, but we haven't got all those details worked out just yet.
Okay, and I have another question where you talked about life skills providers and day service providers if they're one. Wouldn't that, I mean, we're already in a workforce shortage. Wouldn't that take up spots of people already on the comprehensive waiver that are needing those spots?
I think it'd really be up to the provider to determine if they have the capacity to provide more services. I think if I'm understanding your question, you're worried that if a day supports provider who's providing day supports through the IDD waiver also starts providing life skill services to the community support waiver participants, then they're just going to get potentially overrun. And that could limit services for day supports. I think that's, I think that's a great thing to keep in mind. I know provider capacity is something that we'll be working on as we develop a plan with KDADS to recruit new providers for these CSW services. We definitely don't want providers to be reducing their capacity for services that they're already offering on other waivers. So definitely something to take back and consider. Thank you for mentioning that.
Thank you. That's all I have.
Excellent. Thank you, Cassandra. We appreciate the question. Mitzi Tyree, I will turn to you now. If you have a question or something you'd like to add, you should be able to unmute now. Mitzi, like I said, if you'd like to ask your question, you're still muted. All right, Mitzi, in the interest of time, I'm just gonna continue to move on. Like I said, you can raise your hand again or excuse me, just there we go. You can either raise your hand again or put your question in the chat. We're more than happy to answer it then. Paula Brandazor, I hope I pronounced your name correctly. Apologize to anyone whose name I mispronounced today, but you should be allowed to. Oh no, I saw you raised your. Excuse me, I see you lowered your hand. Yeah, Paula, you should be allowed to talk now if you'd like to.
Hi, I put a question in the Q&A, but it was after you were done looking at it, so I thought I better say something. Can you take a look at that?
Yeah, well, I mean, if you're talking now, if you'd like to just go ahead and ask it anyway.
Okay. I asked, will providers be required to retest staff, especially those that drive consumers for drug use? If not, why not? Pre-employment drug screening is not enough. This should be done randomly, semi-yearly. I've heard more than one story of staff or their home or van smelling of pot.
Paula, first off, I'll thank you for the question. And if you feel, regardless of how we answer this, right, if you feel this is something that's important for us to include, this or for anyone else, right, if there's something we're not covering you think should be in the CSW, please visit that CSW website and provide your feedback. You know, this is exactly the sort of thing we want to hear about, you know, if we're missing things or if we're not including things, or even if we're including things you think shouldn't be in there. With that caveat given, Jackie, I will now allow you to weigh in.
Yeah, thanks, Paula. Definitely. So in trying to present this, feel like I'm giving a summary, but don't have time to go through every single detail. So I'm glad that you brought this up. So part of the policy for non-medical transportation providers, which we're mirroring for CSW transportation providers, is that not only do they have to do that pre-appointment drug screening, they also have to agree to random drug screening. So that
Right,
is,
okay,
yeah, part of that. And then, yeah, just to mention, if a participant has like a bad experience with a provider, or notices that the vehicle is not in the appropriate condition or something, those are all things that can be reported, and then can be followed up on to ensure that whatever is going wrong with the provider, that can be corrected. So
gotcha, okay, thank you.
Okay, we'll keep moving through our chat questions for a little while now. This one's from Jeanette Livingston. This is asking, again, where provider types where it says licensed by KDADS, would this mean licensed to day residential or TCM providers? Jeanette says those are the only CSPs that are licensed by KDADS. Jackie, again, I'll start with you, and if Michelle needs to weigh in on the different licensing types, I'll turn to her next.
yeah, I think that one's above my knowledge base. So they were mentioning that CSPs, the only ones who are licensed currently are day supports and residential providers, I think is what she mentioned. Michelle, can you weigh in on
Yeah,
that at all?
yeah, Jeanette's correct. Yes, the community support provider would be inclusive of residential and day providers for that.
Thank you, Michelle. Jackie, I'll rely on you for this one yet again. Are any of the providers required to be affiliated with a CDDO?
Yes, so that was back in our general requirements. So if you are a provider who's like contracted with the MCO to provide certain services, agency directed services, then you would also have to affiliate with the CDDO in the area that you provide services.
Thank you. Jackie, just while you're unmuted too, a quick one. Are there age requirements for the CSW?
I'm guessing that this is for participants.
Yes.
There are, okay, yeah, there are different age requirements for the various providers that differ, but age requirements for the CSW are ages 5 and up.
Thank you, Jackie. And Connie, I will say too, for you and anyone else on the webinar today, if you'd like some more background information on the webinar, you can always go to the website. You can also find all previous town halls there, which we've covered, a lot of other materials. This is our third or fourth one. I can't remember quite. So just visit that website if you have, more questions, maybe on some general sort of background things. And if you don't find answers there, obviously we're always happy to help everybody after that. Let me check. I see we have one more person with their hand raised, Lisa Barkis. You should be allowed to talk now if you'd like to go ahead and unmute and ask your question.
Hey,
Hi, Lisa. We can hear you if you'd like to go ahead and ask your question.
I have um I was thinking that is there providers for sub-minimum wages? And how are they transport?
So I will say for the CSW, Jackie, I'll rely on you for for questions about sort of sub-minimum wages and that sort of aspect of it. I will say as well, Kansas, I should say KDADS, is working on some other programs in this area that more information will be forthcoming about. So Lisa, if that's a particular area you're interested in or concerned about, KDADS would have some more information for you outside the CSW, but that's just not exactly what we're covering today. So I won't dwell on it too much, but feel free to email either us or KDADS for more information there. Jackie, regarding the CSW specifically, are there any provisions for sub-minimum wage, employment, sheltered workshops, anything along those lines?
No, so we, all of the providers have to, abide by the HCBS final settings rule. And Lisa, was your question about like if providers have to follow like minimum wage requirements?
I just thought that if there's any way to transport sub-minimum wages at CDDO.
I think in the services that we're talking about today, there won't be any providers that are offering sub-minimum wages. And the CDDOs won't be providing these CSW services. They'll still be involved in like the assessment, helping somebody go through the assessment process and get connected to services, but they won't actually be the ones providing the service. Hope that answers your question.
Gotcha.
Thank you, Lisa, for your question. That gets rid of everybody whose hands are raised, but we do still have a lot more questions in the Q&A. We have, I think, about 10 minutes, so we'll just keep moving through. So again, please post your questions there or raise your hand as appropriate. So a question from Cassandra Signs. Jackie, or I don't know if this is part of our purview of maybe decisions KDAD's made on the back end, but do we have a reason for why therapies would not be run through their MCOs?
No, therapy services are all going to be like provider, which, okay, I think maybe I'm trying to understand this question. Would not run through the MCOs. By that, do you mean would not be covered by like your regular Medicaid state plan services?
Cassandra, this is your question. If you'd like to go ahead and raise your hand, we'll be happy to call on you again and you can give a little bit more context for us. Or if you'd prefer, you just post an extended version in the chat and I will, or excuse me, in the Q&A, and I'll make sure we get that reviewed. In the interim, I'll just sort of move on, Jackie, and we can circle back to this.
I can answer both. So
Please.
I think if Cassandra is saying that she's wondering, is there any case in which I would get physical therapy through the CSW if I'm supposed to get it from like my Medicaid state plan services? Medicaid state plan services sometimes have like the limitation of it can only last for like 6 months post injury or illness that you need the physical therapy or occupational therapy for. So if that is how I'm interpreting her question, they would get services through their MCO, like state plan sort of services until they ran out after those 6 months, then the CSW would cover it. If Cassandra is saying, oh yeah.
I'm sorry to interrupt. I mean, you might as well just go straight to this. Cassandra's raised her hand. Cassandra, if we haven't answered your question, please, a little bit more context.
Right. It's when you were talking about the services earlier, and you were saying they were part of the CSW. But if somebody has a need for therapy services, it should be run through insurance versus a waiver first. Correct?
Yep.
And that's exactly what I'm saying. I mean, we should not be having these families have to worry about their maximum that the legislators have put in place without any thought to having to expand that maximum for cost of living increases, like inflation, like we've all been going through the last several years. But what, it shouldn't, they shouldn't have to use those funds to pay for therapy services that should qualify under their Medicaid.
Yes, and I would add not only they shouldn't have to do that, they can't do that. So the federal government will want all insurance or state plan Medicaid services to cover what they can before the CSW picks up anything different. The reason why we even include it as a service on the CSW is just in case there's some limitations where the person can't get it through their insurance or their Medicaid benefits, then it could still be covered by the CSW. But you're correct that they shouldn't have to have it covered by the CSW if they can get it elsewhere, and they can't have it covered by the CSW if they can get it elsewhere.
Okay, I think that needs to be made very clear in the waiver that that all therapies need to go through any insurance and exhausted through any insurance prior to running through the CSW waiver.
Great, agreed. I know this is probably something that will also have another future town hall topic to discuss, how all of those different service programs work together. So thanks, Cassandra.
Mm-hmm.
Turning now to the Q&A question from the anonymous attendee. For day services, is there a specific list of expectations that we can view? As Jackie said in response to an earlier question, we're providing sort of a general summary today, right? Content appropriate for the town hall format. On the CSW webpage, we have summaries of each individual services, and we've also linked to the complete documentation there as well, the full PDF. So if you want a little bit more information than you're getting right now, or even more than you can find directly on the website, feel free. We encourage you, in fact, to browse that PDF, and that should have basically all the information we have available for public consumption right now. Jackie, anything to add there that they can't find in that PDF?
Yeah, no, I'll just mention that I know there's a lot of mentioning of the day services or day supports, term of services. So that's because currently on the IDD waiver, you have a day services. Those Kansas is working on unbundling those services, so you won't just have one service that's called day supports. You'll have those kind of individual services that are like the life skills services, the individual employment supports, the career exploration and planning. And then those will be offered on the CSW. There are 2 day service types that are being unbundled that won't be offered on the CSW. So I just want to also make that clear, that like the day supports for like older folks and retirement age folks, and then the I forget what the other term is, Michelle, if you remember, there's another unbundled service that's coming out of day supports that will be offered on the IDD waiver, but won't be offered on the CSW. So just want to flag there that there are some differences between IDD waiver and how you view day supports now and what will be offered on the CSW. So just to flag that, to make sure you're paying attention.
Thank you, Jackie. I'm afraid I'm going to possibly rely on you for the next 4 minutes of our Q&A session as well, Jackie. So we'll just keep going. The CSP license, an anonymous attendee asks if that is a formal license received from KDADS. This seems similar to the earlier question that I believe it was Jeanette Livingston asked, where those license, in that case, it would be a day residential or TCM provider, correct?
Yeah, this community service provider is a formal license from KDADS. It's written in statute. I don't know if Michelle, you want to provide any other more detailed information on that license?
Yeah, they go through any of the CSPs go through licensing with our SCC commission. So, and I'm not sure, what was the question again exactly?
Just a question about the CSP license, and if that's a formal license KDADS
Right,
gives out.
yeah, it is a formal license. And I believe they go through the licensing, I believe, every 3 years. And we are meeting with our counterparts at SCC to talk about what they're going to be looking for when they're licensing community support providers, service providers under the CSW. We're still working through that now.
So I'll do a couple as we sort of wind down here on time, couple we can get through a little bit more quickly. April Dales asks how this works, meaning the CSW for people already on the IDD wait list. Again, we're getting a lot of questions on this. You know, we understand why people are concerned about it, but we haven't quite worked through that just yet, sort of the relationship between the two. As I've said in previous town halls, we'll make sure that information is very available the second we have it for y'all. Colleen Hunter asks about the potential start time for the CSW and how it might relate to or be affected by the conflict of interest issues or work that KDADS is also working on. So I will say, Colleen, we have a sort of proposed timeline for our side of the work, meaning PCG and KDADS, the drafting piece. You can find that original timeline in, I think, our very first town hall, if you want to check in there. That being said, obviously CMS approval is a very large part of the process, and we can't tell CMS when to approve it or when to get through it. So that is a question mark. As you said, CMS is also looking at that conflict of interest issue, and it could affect when the CSW is approved. So Michelle, if there's anything more you'd like to say about that beyond just, KDADS is aware of this, we're working on it, but at a certain point, we do need to hand things off to CMS.
Right, yeah, we're working hard to deal with both, building this waiver, which we're hoping to have approved by CMS in, approximately April of 2026. We have to give CMS at least 6 months to review it. So we have to have a completed application 6 months more. 6 months before April, so we're looking for October of 2025. The conflict of interest, we are working on with providers. We're going to be working on providing grants to help them work through the conflict of interest questions. So there's a lot on our plates, but we're very determined to make sure that we meet all of our requirements with CMS so that we can launch the community support waiver in April of 2026.
Thank you, Michelle. At this point, that ends our first question and answer period. If time allows, we will return to these at the very end. But for now, Lisa, I will turn it over to you so we can continue with our presentation.
Thank you so much, Peter. Thank you so much, Jackie, for your presentation. So we will now transition to talk about the rate study, which is required to help us complete the CSW. So I will pass it over to the rate study team.
Right. Hello, everyone. Just making sure audio is good. Awesome. All right. So let's go ahead and get started and talk about rate setting. And the first thing we're going to do is this slide here, just why are we here? What does it encompass, specifically as that pertains to the community support waiver and intellectual developmental disability waiver. So putting it straightforward, rate setting is a process to develop the rates paid to providers for delivering waiver services. The direct care that we're talking about here encompasses quite a bit, specifically for individuals with disabilities, elderly populations, and those needing behavioral health assistance, all of whom depend on the reliable, quality, consistent care. So it's a role that changes heavily based on the individual and affects their livelihood just as much sometimes. You'll see that next point, and something we heard a bit earlier today was on the workforce crisis that we're facing in this direct care support role. So overall, higher competitive rates are going to attract and retain those skilled caregivers that we need in this field. It's not something that you can see on a job description that just has a bunch of bullets. Each individual is going to have a complex set of needs that um, is really built on by this process here. So when you don't have those high competitive rates, what happens is you result in things like high turnover, staffing shortages, things like that, sometimes called a revolving door problem, in which individuals face gaps in their service. Which can lead to burnout in the staff. It leads to trust issues related to the services attempted to be offered. All this to say, rate setting is very, very important work. It's not just about assigning a cost here. We're looking to really build a system that values the workers, meets the client needs, and ensures that stability and sustainability within the direct care ecosystem. So next slide, please. So this is going to be a bit of reading, not gonna lie, but it's going to be important to kind of level set, get our heads around the requirements from a federal perspective, as well as how we're looking to make best practices based off of those requirements. So at its base, the Medicaid program, including HCBS, Home and Community-Based Services, operates according to laws set forth in the Federal Social Security Act and is administered by the Centers for Medicare and Medicaid Services, CMS. This next one's really important because this is kind of that main piece of it. The section of the Social Security Act states that rates must be consistent with efficiency, economy, and quality of care and are sufficient to enlist enough providers so that services under the plan are available to beneficiaries, at least to the extent that those services are available to the general population. All that to say, we're looking to create services that can go to that general population. That last part is really the big piece that we like to hone in on. Next, CMS requires states to reimburse Medicaid qualified providers for services defined in the federally approved HCBS program delivered for individuals enrolled in a Medicaid HCBS waiver. CMS reviews changes to service fee schedules rates by comparing those rates to those of other payers and other Medicaid rates. And it's recommended that states examine those costs every 3 to 5 years to account for market salaries, evidence-based practices, and administrative costs. So this slide summing it up is just saying that we are looking to build rates required by the law to the extent that it applies to all of those within the general population. Next slide, please. All right, this one's a bit more active looking, so that's good. This is our general project process. So the first point, or on the far left, you can see that we start initially with that research, tool development, and stakeholder engagement. Every state and every year, honestly, is going to be a bit different. So we really take the time to kind of look at the resources that we have available to build that groundwork, to build that plan from the foundation. Work a lot with our stakeholder group, KDADs, to work on those kind of points that make this a bit more specific to the state of Kansas. And then we move on next to provider outreach. So after we built that foundation, we're looking to reach out to those individuals, communicate what's going to be occurring, why, how, etc. And the two biggest points of this are going to be the cost study and time study. So those next 3 points kind of cover that. We have a training that goes over those different tools, the cost study tool and time study tool, with those tools taking place through the months of December and January. And lastly, we have the big, everyone's favorite part, which is data analysis, findings and recommendations, where we share all that we've come up with so that we can get those rates locked in and look to build more of that sustainability that we talked about a bit earlier. We'll get a bit more into the specifics on each of these parts of the process. So now I'm going to look to hand it over to Kristen.
All right, thanks, Javante. So I'm going to go into a bit of detail here over the next couple of slides on our methodology for the rate study. The rate study for KDADS includes 3 main cost collection tools. So that's going to be the cost report, the personnel roster, and the time study. The cost report is where we really hone in on the provider's expenditures and revenue, and that's what we pull to make a cost-based rate. We look at the personnel roster, and this allows us to do an analysis of salaries by position across the state. We also do a turnover analysis and an assessment of correlations between salary and credentials. And then the time study is where we do an analysis of direct service time and indirect service time. And this gets pulled into our hourly rate build as well. We use market data when provider data should not be used. So for example, the market salary analysis would be a component that plays into that. This also includes the full cost of services and standardizes payment rates for all providers of each service type. All right. So what does all of that mean? This is a really great visual here that just shows a brief calculation, really high level of what our rate builds look like. So it first starts out with the hourly personnel cost. And again, that comes from the personnel roster. We then add in the admin cost, so an hourly administrative cost from the cost study. We then pull in the non-billable costs, and this comes from the time study. So we calculate a billable and non-billable percentage that's based on that indirect time. And then that all gives us our rate recommendation. And we typically build out an hourly or a 15-minute per rate for services. All right, another great component to our methodology that I think is super important is our quality assurance and data representation. So quality assurance is an important step in the rate setting process, and that includes 2 levels of review and a final sign-off of each tool submission, and it accompanies backup documentation for accuracy and completeness. The reviewers then email a summary of the QA findings and follow-up questions to the providers. And then based on those answers, we either edit the data or we omit some of the data. Other examples of why we may omit or exclude data is if some provider data is 2 standard deviations above the mean. We also calculate the confidence interval to ensure that the community provider cost data received represents the population. So in cases where a 90 or 95% confidence interval is not met, PCG will leverage other sources of data to fill in any potential gaps, such as market salary analysis benchmarks from the Bureau of Labor Statistics. And I'm going to pass it over to my teammate, Sheena.
Thank you, Kristen. A lot of people have been asking what services are going to be included on the community support waiver or included in the rate study at large. KDADS has finalized a list of 19 services that will be included in the community support waiver, including some new services along with services that are currently offered on existing waivers. Next slide. The 4 services listed here are those that are included in the rate study but are being restructured under the existing IDD waiver. Next slide. Questions have come up as to which agencies should be participating in the rate study and completing the cost report and time study workbooks. We've added this list here for clarification, which is taken from the services currently being provided, along with the corresponding procedure codes. We strongly encourage partnership with any agency providing one or more of these services, as our participation is important. Our partnership and participation is important to developing accurate rate recommendations and getting services to individuals who need them. Next slide. The cost report training webinar was already held last week, and the cost collection period is currently underway. Next, we've asked all participants to return the workbook by the close of business on January 3rd. After that is the time study, and those training webinars will take place at noon on January 7th and January 8th. The time study workbooks will be due by the close of business on February 7th. All tools and supporting documentation will be submitted to our project email, which is kdadsratestudy@pcgus.com. Any questions that arise can also be sent to this project email address. The project website, kdadsratestudy.weebly.com, has a wealth of resources for download, including the cost report and time study workbooks, instruction manuals, and FAQs, as well as a recording of the training webinars and the PowerPoint presentations. The resources related to the cost study are currently accessible. However, the materials related to this time study will not be live on the website until that training has concluded next month. Next slide. For added support, participants will be provided designated office hours made available to assist participants throughout the data collection period. But again, we can be reached anytime by email at kdadsratestudy@pcgus.com. We can now stand for questions.
I believe that opens things back up to me then. So we do have a few questions still left in the chat as we sort of wrap things up. I will say as well, if you have been posting questions in the chat, in the meantime, Jackie has been working diligently to answer a few of those. So please do check to see if your question has been answered. At this point, I'll just continue sort of working our way through them. So Jackie, I apologize to bring you back into the fray, but I think most of these will still be for you. So this question from John Girdle. I think this relates to an earlier question about drug tests for drivers and other providers, things like that. Do you know if those extra tests, including drug tests, would be covered by reimbursements to providers?
So I'll start answering this, and then maybe if the rate study team wants to add anything else, they can. So John, there won't be a specific way for a provider to bill the state for a drug test that they do on one of their staff members. I will say when building the rates, which the rate study team might want to talk about, they take into consideration all of those other things that may be required of the provider into how they're developing the rate. So I don't know, Kristen or Javante or Sheena, do you want to talk more to how you take into all of those extra costs that providers have beyond just paying their staff and how that gets built into the rate?
Yeah, sure. So a big component of the cost report is a section for non-personnel program expenses. And that's where you would capture for fiscal year 24, any related costs to administering drug tests or things like that. It's all of your operational costs really allocated to support the delivery of that service is going to be captured in the cost report in that section. That then gets pulled over into an admin percent. So in our rate build, we take a percentage of those costs to your overall costs and pull that into the rate to ensure that things like those items are included. I hope that answered your question.
Thank you. I'm sure it did. We have a few more now coming in for the rate study team. Thank you, everybody who just posted those. So we will turn to those now while we have the rate study team here and talking to us. So a question from an anonymous attendee about sort of accounting for costs of maintaining support capacity. So like, how does the rate study account for things where, maybe there are periods going by where individuals aren't getting direct services, but a provider needs to maintain that capacity so they're ready to respond immediately as any service needs arise.
Yeah, this is a really great question. I know this was an anonymous attendee, but I would love to hear a bit more about your question and the background here to better understand exactly what you're asking. Otherwise, I will say, if I'm understanding correctly, we do take into account indirect activities. So the items that are not typically paid for with that billable one-on-one time. So when you are providing direct services, and in our time study, we measure those indirect activities. So all the components that are supporting a direct service, and we pull that into our rate build.
Thank you, Kristen. And as we said, if we're not quite getting at what you need, anonymous attendee, feel free to post in the chat. Or as we've said, our feedback line is always open. So you can send us questions about the CSW directly, or I'm happy either our email address, or you can see here on the screen, the project email address for the rate study is right there. You can send any rate study questions directly to them, and I'm sure you will get a much quicker answer if you send it to us and we had to route it back through. There was also a question from Kathy James about the website for the rate study. You can just see it right here on the screen, kdadsratestudy.weebly.com. So if you want more information on it, feel free to check that out. Regarding that website, does it include any of the rate study trainings? Are those recorded, and if so, can people find them, on the website or elsewhere?
Yep. So all the recordings for the trainings are going to be on the website. We have completed the cost report training, so that webinar recording should be on the website, and then the time study training will occur 1st of January. So we have not conducted that training quite yet, but once we do, we'll have the recording up on the website.
Excellent. Thank you, Kristen. And regarding that website, just a couple of background questions from Jeanette Livingston, just about, how providers were informed about the study, how many participated, the areas they come from. Is that sort of information included as part of the website, or would it be easier just to answer the questions now?
Yeah, I'll jump in and answer. We sent out emails to the group of providers who are included in the rate study. And I believe we've sent out several initial emails and then some reminders. So if you haven't gotten any of those emails from us, please reach out. We'd love to hear from you, and we can work with you to get you included in the rate study. We have not received our full lump of submissions yet, so I can't answer how many providers are participating in the study. It is voluntary, so it just depends on how many folks complete the cost report and time study. But once we do finish the study, we'll know how many participated, and we'll be able to share that information. And then your third question, does it include providers from a variety of areas in Kansas? Yeah, we're hoping it does. So we'll do a geographic analysis to ensure that the sample of providers is representative of the population.
A couple more questions for the rate study people while we have time. Is there a succinct way to explain how the cost of benefits might have been included in the rate study?
Yeah, there is. So in our personnel roster, we have a section for salaries and benefits. And we take that benefit at an aggregate level, those benefit dollar amounts at an aggregate level, and create a percentage of benefits by position type. So for example, for that direct service staff person, we'll have an average percent benefits that's allocated and included in the rate study. So that is an important component that we put into the rate build.
And a similar question about sort of projected services, right? Like, is there a methodology for how you've projected costs and rates for services that aren't currently being offered? So there's no historical data.
Yep, this is a great question because the CSW does have a lot of services that are new. And in this case, we'll be using benchmarks. So PCG conducts rate studies across the country for very similar services, if not the exact same service in another state. So we'll review those benchmarks used in those rate builds in other states, pull those in if they apply to the context of the service that we're developing a rate for. We'll also do a peer state analysis. So we'll meet with other peer states, ask them what they're currently paying for the service, components like that. But it's mostly benchmarks and then also a market salary analysis. So using the Bureau of Labor Statistics and pulling in that direct service staff person that will be providing the service and ensuring the salary amount is accounted for. So components like that, it's a lot of benchmarks and different market salary analysis components.
Excellent. Thank you, Kristen, and the rest of the rate study team. I think that's our last direct question on the rate study for now. So let me just give a final plug for that project website. Again, kdadsratestudy.weebly.com. If you have questions about the rate study, want more information, want to review some of those previous trainings, please go ahead and check that out. Lisa, I will now defer to you. I know we have about 2 minutes left. So do we want to keep covering questions, or is there more content for us to get through?
We just have a few closeout slides. So I think we should wrap things up here. And we'll still do our best to make sure that we answer your questions or provide some resources. So next steps from this meeting, you can go to the kansascsw.com website and view the service definitions and other provider qualifications that we discussed today on the website and provide feedback. And so feedback might look like something, if you see a definition and you think it should be improved, constructive feedback would look like, I think it should be improved in this specific way, or I think this should be added or taken away. So that is what we mean by constructive feedback. And then obviously we talked about the rate study a lot, so you can participate in the rate study. And in addition to giving feedback on the service definitions, there are multiple ways we can all participate. We have that email, there are specific feedback forms, and we will have a comment period coming up eventually, and continued town halls, as well as the technical advisory group, the TAG. And we can just close it out. Thank you very much to our interpreters for providing services today for us. And thank you all for your time. It is so appreciated, and your feedback is so important. So we will see you back here on January 15th. So look for an invitation. So thank you so much to everybody for joining today.